Hello guys, welcome back. Today we will discuss another psychiatric topic, that is treatment for substance abuse. In a previous class we had a discussion regarding what is substance abuse. I will upload the link of that video in the description box. Just please go through that. Then you come to this video, then it will be very easy for you to understand. You will get a continuation, so don't forget to click the link in the subscription box. Just watch it once, and after that just start watching this treatment for substance abuse. So in this video we will discuss three things: detoxification, what is naltrexone treatment, and what is methadone treatment. So what is detoxification? I think this word is familiar to you guys. Detoxification, in the advertisement and all, we used to see this word. Detoxification means it's nothing but the process of clearing your body, cleaning your body from dust. Okay, so in the case of substance abuse, what does detoxification means? It is the process of clearing your body from alcohol or substances which you took excess. The purpose of detox is effectively manage withdrawal symptoms when someone stops taking alcohol. So detoxification is a process. Step by step the process will take place. Then only the person can manage with withdrawal symptom. For example, a person is continuously taking alcohol and completely addicted and completely depending alcohol from morning to evening. Okay, so in that case, suddenly if you're trying to stop the alcohol intake, or if you take the alcohol from that person, means lot of symptoms will arise in the person. His or her body will not adjust with the particular situation. So the detoxification process in substance abuse or alcohol abuse will take place in step by step. And the detox process will make a person stable both physically and mentally to start any other therapy. Detoxification is not only the therapy. Okay, so this is considering as the first step of therapy. After that we will go for further treatments, further therapies, further sessions to make the person to come back to his normal life or to her normal life. And one point you have to keep it in your mind always, that each individual's reaction towards this detoxification process is entirely different. That means each individual react in different way towards detox process or detoxification. Now we will see the process of detoxification. First thing in the detoxification process is assessment. A thorough medical assessment, that is very important. Without understanding the situation of the patient, you cannot start the detoxification process or any kind of drug therapy. So thorough medical assessment, thorough present and past medical history collection, present and past surgical history collection, and present and past psychiatric history collections are very important. After that you can start the detoxification process. Depend upon the condition of the patient, you have to plan personalized detoxification process plans. Then it will typically last for 7 to 14 days. 7 to 14 days. Normally 28 days detoxification programs are there. Okay, but the main thing will complete in 7 to 14 days. And during the time of this process, you need to monitor the withdrawal symptoms. As I have told you, lot of withdrawal symptoms will arise in the person. If you are not caring in the proper way, there are chances of even unconsciousness, even death, coma, etc. So minor to major, minor to severe, what are all the withdrawal symptoms are coming, you have to observe it, assess it, and you have to understand what is each person's response and experience towards this detoxification process. And this detox withdrawal can result in wide range of physical and psychological symptoms. So provide psychological support, emotional support. That is very important in detoxification process. I told you about withdrawal symptoms. Lot of withdrawal symptoms arise in the person. Some withdrawal symptoms I will tell you, like nausea, diarrhea, vomiting. These are all the common things, guys. Then shivering, runny nose, increasing the heart rate, increasing the blood pressure rate, muscle pain, different unusual pains, unpleasant dreams. That is a psychological aspect. Okay, and irritability, anxiety. The patient will feel anxious, irritability, confusion, paranoia like hallucinations and all. Then depression, agitations, extreme mood swings. Their mood will get changed like anything. Then while coming to the most severe withdrawal symptoms, they will show hallucinations, they will show delirium, and sometimes they will show seizures also. So don't get panic. These are all the symptoms when we stop the intake of alcohol. So gradually you have to implement the plans, and you have to observe, and you have to provide proper physiological and psychological support to the person. The next thing is narcotic antagonist therapy. That is a therapy which is using to treat substance abuse. Narcotic antagonist therapy. In narcotic antagonist therapy, mainly we will use naltrexone. That is the most commonly used or most promising narcotic agent, and which mainly used to block the euphoric and other effects of opioids which you took already. So it is using to prevent the extra effect or stop or block the euphoric and other effects of opioids. And one important thing and very special thing about naltrexone is it has very less side effects. Naltrexone is approved by the Food and Drug Administration to treat both alcohol and opioid use disorders. So it is approved by the Food and Drug Administration. While coming to the dose for adult, initially to 25 milligram we need to take, then increase to 50 milligram daily. Total weekly dose may be divided and given on 3 days of the week, and overdosing leads to acute opioid intoxication. Overdose is a complicated thing. And under the supervision of a healthcare professional, we can take high dose, sometimes 100 to 150 milligram in 2 to 3 days, but supervision, vigilant monitoring, that is very, very important. While coming to the side effects, nausea, vomiting, headache, insomnia, restless, cramps, runny nose, chills, blood pressure problem, fever, increasing the temperature of the body, all these things we can see. Then, if you miss a dose, try to take as soon as we remember. But the time is up and near to the time of the next dose, skip the missed dose and take the next dose at the regular time, because double dosing can cause severe side effects. So please guys, do not catch the double dose. And what is the mechanism of action? Means this medication blocks the effect of opioids, euphoric effect of opioids, opioids drugs like heroin, morphine, codeine and similar drugs. However, the large dose of heroin can overcome this block and is very dangerous and may cause injury, loss of consciousness and even death. So what is the mechanism of action? Means this will block the effects, euphoric effects of heroin, methadone, morphine, codeine, etc. But if the heroin amount or the morphine amount or the codeine amount is large, means larger dose of these drugs can overcome this block and very dangerous, and sometimes it may lead to death also. The next type of treatment is methadone treatment. Methadone is a man-made opioid. It is a man-made opioid and also known as opiate. Methadone use will help to stop taking heroin. So it is normally using as a substitute for heroin. Heroin is problem for body. It can create a lot of complication, even death. But the substitute methadone will help to overcome the use of heroin, and it will use like a substitute instead of heroin. German doctors created these opioids during the World War II, and when it came to United States, their doctors used this to treat extreme pain. So it is used to reduce pain, extreme pain guys. And in two ways you can use this methadone, that is maintenance therapy and detoxification method. In maintenance therapy, you will use heroin substitute like methadone instead of heroin, then stay on the stable dose of substitute. So here this methadone is used as a substitute. Next thing is detoxification. Here you will change from heroin to a substitute methadone before gradually withdrawing from the substitute. So we are completely free from both. So we'll start together and slowly we'll stop the intake. Methadone is also used for severe pain, as I told you, and end of life care. In the end of life, severe pain and the patient cannot tolerate the pain means in that stage, methadone will prescribe by the doctors. And don't take alcohol along with methadone because it can cause severe side effects. Methadone is also an addictive like other opioids because it is used as a substitutes instead of heroin, so it is also considering as a addictive. So based on the doctor's guidance only you can take this methadone to stop the excess use in the future. It is in liquid form normally with green in color and dosage is vary from person to person. Usually start on 10 milligram to 30 milligram taken once a day. This can be increased slowly and many people then take a regular dose between 60 milligram to 120 milligram a day. And it is a prescription drug. Under the prescription, doctor's prescription, it's important, and so it is considering as a prescription drug. Methadone changes the way our brain responds to pain. So it will help to reduce the pain. So methadone changes the way our brain responds to pain. It affects are slower than stronger painkillers like morphine, and it can keep you away from having withdrawal symptoms and cravings. So, while coming to the side effects, breathing problem, sweating, itching, headache, sexual problems, pains, cramps, dry mouth, mood problems, etc. So this is about methadone treatment. Okay guys, so this is about the treatment which mainly used for substance abuse, detoxification, antagonist, naltrexone treatment and methadone treatment. Hope you understand guys. Thank you.